Welcome back. I'm Dr. Rajeentheran. I'm the urologist in KPJ Dhammatara Specialist Hospital. Among the other cancers that we treat is bladder cancers. Now, what is bladder cancer? Bladder cancer is a cancer that occurs within the bladder itself. Now, we can have two different types of bladder cancer. One is superficial bladder cancer, the other one is deep invasive bladder cancer. Now, the bladder cancer is superficial is a good news because we don't need to remove the bladder. We can just scrape the tumor out and give some amount of chemotherapy into the bladder. When it becomes muscle invasive, we have to remove the whole bladder. Then we have to substitute the bladder with a new bladder or have a urinary diversion with an ileal conduit. Now here is some diagrams here of the bladder tumor. Now this is how bladder cancer presents. There's a small growth within the bladder. Okay, they usually look like this. It's like a grape-like inside the bladder. Now, how do the patients usually present with bladder cancers? The most common presentation is blood in the urine. So whenever you see the blood in the urine, you must go to the urologist immediately. You may not have pain. You may not have any other symptoms. You can eat well. You have good appetite, but you have blood in the urine. Rush in and come and see the urologist. This is how we stage the tumors. This is how the bladder tumor looks like. It looks like grape filling up inside the bladder. We have different stages for the bladder cancer. You can have a small early stage. This one we can get and manage to cure. When it comes into the muscle, this is the later stages, T3, T4, then we have to remove the whole bladder out. This is a diagrammatic representation of bladder tumors. This is superficial. Superficial can cure, superficial, but this becomes very deep. When the bladder tumor goes inside the muscles here, then we have to remove the whole bladder. Now for superficial bladder tumors, what do? We can actually do a scope into the bladder and we can scrape out the bladder tumor. Then we can give chemotherapy. Now that's very simple. It's known as minimally invasive management. Now when we do a scope, this is how a bladder tumor will look like. Then we use a resectoscope and we can cut the bladder tumor. See, like this we can cut the bladder tumor and remove the bladder tumor. Very simple. Okay. Now this is for superficial bladder tumors. Now some of the bladder tumors go inside the muscle. Then we need to remove the bladder. These are kidneys, this is the ureter, this is the bladder. Sometimes we have to substitute the bladder and put a new bladder. But sometimes we have to put an ileal conduit. That means we remove this whole bladder, put an ileal conduit with a stoma, and from here the urine will start passing through. We use the ileal conduit and the stoma and all through the intestine. We cut part of the intestine, build up the intestine here, and then the ureters will come to the intestine, and through the intestine we have the urine coming out. So bladder tumors, we can cure bladder tumors. Bladder tumors and bladder cancers must be treated early. If we do not treat early, it becomes muscle invasive, it starts spreading. If it starts spreading, we cannot cure it. We need to give chemotherapy, and invariably after 12 to 18 months, it will start spreading and cause death. So how do we detect it early? If you have urine in the bladder, your blood in the urine, you need to see the urologist immediately within the first 2 weeks. And then we decide, detect, and then manage it and treat it accordingly. Thank you. Okay, what about the results of this operation and its cause? Now let's say for kidney cancer, we need to remove your kidney. We can do it laparoscopically. The charges will come up to almost about 25,000 and above ringgit. And usually the patient will be here only for 3 days or 5 days and then can go back home. They can immediately start walking. They can start working if they want to after 1 week or 2 weeks also. When it comes to bladder cancer is actually a major operation. They may be here for almost 5 days, 1 week in the hospital. They can walk back, they don't need a wheelchair, but maybe they go back to work within 4 weeks or so, 4 to 6 weeks. When it comes to prostate cancer, they get discharged within 3 days. It may cost somewhere around 35,000 and above ringgit. And they can be discharged within 3 days itself and start walking back.